Hello everyone, my name is Dr. Carl Mangum and I'm with the University of Mississippi School of Nursing. I'm here today to talk about anaphylactic shock. What is anaphylactic shock? Well, it's an allergic reaction basically. A person has developed antibodies to a certain antigen they've been exposed to and that causes the reaction. This reaction can happen almost immediately, sometimes just in seconds. Other times, with certain reactions, it may even take hours before they develop. There are common things out there that cause these type of reactions and anaphylactic shock. First, let's talk about food. One of the most common are peanuts. Other nuts, shellfish, including shrimp, lobsters, milk, eggs, soy, wheat. So there are a lot of different areas in food that can cause this type of reaction. Insect stings would be the next one. Bees, wasps, hornets, yellow jackets, ants, including fire ants, any type of insect that can inject venom carries the possibility of creating anaphylactic shock. Next are medications. Several different types of medications, including antibiotics, vaccines, chemotherapy, are just a few examples of medications that cause this type of reaction. And also latex. And in the healthcare field, we have to be mindful of this because many of our tools, including our gloves, contain latex. As with anything, you need to make sure that the person you're working with, your client, you have a good understanding of any potential allergic reactions they may have, whether it's food, medicines, latex, insects, whatever the case may be, so you can help try to prevent that. Next, let's talk about some of the signs and symptoms related to anaphylactic shock. A person may have several of these at varying levels of severity. The skin. If it's been a bee sting, it may just be in one part. If it's been something systemic like food, it could be all over the body. With the skin, there can be itching, hives, redness, swelling. In the nose, it could be stuffy, it could be runny, and they could have sneezing. In the mouth, they may complain of itching, swelling of the lips and the tongue. They may complain of trouble speaking. In the throat, they can complain of it being itchy, swelling. They complain of difficulty breathing and swallowing. In the chest, there could be a shortness of breath related to the lungs, coughing, wheezing, chest pain, and tightness. With the heart, there may be arrhythmias, a weak pulse, passing out, and even shock. With the GI, there may be nausea, vomiting, diarrhea, and cramps. And with neuro, it's a possibility of fainting or dizziness. Again, they may have one or more of these signs and symptoms related to and at various levels of severity. Let's talk about prevention. If the reaction is known, usually from a previous experience, try to avoid that trigger or whatever's caused that before. Quick story. I was boarding an airplane, and they made an announcement that anyone getting on this flight, if you had peanuts or food containing peanuts or had been exposed to peanuts, they would like for you to go wash your hands and discard that food in a trash can before you got on the plane. They announced that there would be a young child on this flight that had a very bad allergic reaction potential to peanuts. And they were trying to prevent that from happening during flight. An excellent way to try to use prevention. Next, the person that knows they have this type of allergic reaction, they should have a medical ID bracelet or medical ID necklace, or a card that can be set in their purse or wallet. What this does, it allows medical personnel, in case the person cannot speak for themselves, to have an idea of what may be wrong with the person and how to start treating them. Of course, the best way is just to avoid what causes the allergic reaction and the anaphylactic shock. People also carry medications with them. It can be in pill form, liquid form, or it may be in an auto-injector form, and this is one example of that. They can use it to quickly give medication if they've been exposed to whatever causes the allergic reaction. Very important. Probably the most important thing to remember is to keep one that's in code date. Now let's talk about how to diagnose anaphylactic shock. The World Allergy Organization for the Assessment and Management of Anaphylaxis in 2011 published a paper, and it described these criteria for diagnosing. You have to have one of the three big items in this to be diagnosed with anaphylactic shock. First, there's an acute onset with number 1. There also has to be, with that one, respiratory compromise or a decrease in blood pressure. That's number 1. Number 2, there has to be 2 or more of these. Skin or mucosal, or together skin mucosal tissue involvement. Respiratory compensation, decreased blood pressure, or GI issues. Has to be 2 of those 4 things. Number 3, concerning decreased blood pressure. In infants and children, we look for a decreased systolic blood pressure or a 30% decrease in their systolic blood pressure. In adults, we look for less than 90 systolic blood pressure or that 30%, greater than 30% decrease of their baseline systolic blood pressure. That concludes what is related to anaphylactic shock. Thank you.